Start with 10 pounds. After 4 weeks, add
I
another 10.
know, and let's not call it anything at all. But
But that is, that is that you're right. I mean, it is. I think the idea of this classification, categorizing things in terms of static positions
yeah,
and dynamic positions,
that's right.
um, or
Fixed
transitional
points.
positions,
That's right.
because when I give the introductory talk about development and breathing and bracing, um, I point out that newborns obviously breathe with their diaphragm,
Mhm,
but they're totally unstable.
mhm.
So to just and I so I'm just bringing out the point that to just simply give somebody diaphragmatic breathing is not appropriate if you're trying to train stability,
Mhm.
because just simply we all know just simply breathing with your diaphragm doesn't stabilize you. So you have to qualify diaphragmatic breathing with a term like controlled diaphragmatic breathing. The control is through obviously the musculature around the
That's right.
spine and pelvis that
Mhm,
controls it, that generates the pressure.
mhm.
In the same way, you know, when we talk about undifferentiated patterns, differentiated patterns, I say it's not enough to just simply say this is a differentiated pattern. You have to qualify it by saying, okay, it's a ipsilateral differentiated pattern or a contralateral. Now it seems that you have to qualify a little further and say this is a static differentiated
Yes,
ipsilateral pattern where Robert is holding on to the ballet bar, has
that's
his
right.
ipsilateral foot on the ground, and is doing whatever the hell he wants in the
That's
disarm of his
right.
leg, which is different from I'm going to roll from my back to my
That's
belly.
right. That's right.
And
And
obviously the muscle function within static things versus more dynamic things is different.
yeah, that's right. The chains are not, but the muscle function is.
Yeah. Chains are
So,
different than patterns.
so there we have it. But I just brought it up because it's been something of interest to me. Because as you are trying to bring up trying to create a comprehensive assessment, a battery of tests,
Right.
then you have to consider what it is you're testing. You just can't keep on testing ad nauseum, this, that, and the other. You must know that it's different. And um, if they belong to a particular family of, of patterns or movement patterns, that will make it unnecessary for you to test in minutiae these
Mhm.
variants. But anyway, that really was something that, again, links back to the fact that if you have a muscle that you have to strengthen, uh, you have to be creative in blending your pattern, your fixed points, and the goal of the movement, and how to isolate a particular muscle as an agonist, um, as much as we pay attention to, when you're coming up from oblique sit, that you use the knee and not the shin as the support point. It changes the whole exercise. So
Mhm.
that is just as important as making sure that you have the right muscle doing the work, and not missing it, and teaching something that is not ideal.
I
So
mean,
that
kind
was,
of stepping back from what you're saying. I mean, in one sense, you're very basically saying we need to fully understand where the deficit is so that we can come up with an exercise that is actually getting at the deficit.
yes,
And
absolutely.
and the problem, I mean, the problem is always the same problem.
Mm,
The thing that we're analyzing is extremely complicated.
it is.
And you and I are sitting here already saying we don't actually understand it all fully.
Mhm.
So to try to analyze something that complicated that we don't actually understand fully and then give an appropriate exercise is obviously complicated and
It is
difficult.
complicated. It is hard work. And, hard work is always hard. It's never been easy. And that's why
Hard
sometimes
work has never been easy.
it's never
I
been
like
easy.
that.
And sometimes when
I'm gonna
people
make a
go,
t-shirt.
well, can we simplify this? I go, no, it's hard. It just is hard. Just do it. It's like when you show somebody exercise and he goes, do you have another exercise that will help me achieve the same goal? You go, no, I just showed you the exercise that is going to achieve the goal. And that's the best one so far. So hard work has never been easy. Just bite the bullet and do it. And that is why, again, testing in and having a battery of tests that you can turn to and bundling them is really important. So, like yesterday, I had a patient, we went through straddle on the floor, tripod, rocking backwards, Faber, um, uh, straight leg raise, internal rotation at 90. We had to do a whole battery to actually go, wow, you are tight in the sagittal plane in your right hip, and you're tight in the transverse plane in your left hip. So you need two different stretches for each side. You're not going to accomplish it by just doing the same thing each side, because both sides are showing different things in the tripod, in the straddle, in the Faber, in quadruped, in the sides. So you had to bundle them together in order to come up with a formula, because otherwise it was complex, and no one test would tell you
Right.
what you needed to know. So it is an obvious obligation to look at testing batteries so that you can really hone in on what is the difference from side to side that may be the problem, and what would be an appropriate stretch. And this really can be challenging because, again, you have to standardize the tests or they're meaningless. If you do not have the patient do the same thing with the same widths on both sides, well, they've just compensated and you're not going to get anything out of it. So that is really a challenge in the clinic, um, um, using markers on the floor, giving clear instruction, making sure that the hand placement or the foot placement is the same on both sides for the tests, etc. But it can lead to an exciting session with the patient because you are discovering things about the body that you would not otherwise know. And it may help the patient really make big strides in their in their rehabilitation. So that's really something I think is exciting and excites me in clinic, trying to find batteries of tests that will go together, especially for the extremities, the four spherical joints that rarely, with asymmetry, start to affect the equilibrium of the canister or the equilibrium of force transfer from limb to limb. Yeah. So that's really it.
If you enjoyed this conversation and want to hear more like it, then please like this video and subscribe to our channel. You can also stay up to date on our latest seminars on our social media pages on Instagram and Facebook at IMTR Seminars.